they look complex, right? So we're going to do the shoulder joint and the knee joint. Yeah, question?
I think you said somewhere in the video lecture that you show us how to moonwalk.
Yeah.
Oh, I did? I'm not very good at it, but all you do is, so you do plantar flexion, and then you want to, sorry. Okay, so the shoulder joint, this looks hard, right? There's a lot of stuff on here. But it's not that hard because you know a lot of the stuff already anyway, okay? So, for example, let's just start with the bones because we've already done the bones. What is this bone here in the middle? Humerus, right? So we actually have two of these. This is the head of the humerus and the humerus labeled. All right, so that's easy. All right, what are the other two bones that are at the shoulder joint? Scapula and the clavicle, right? So here's our scapula, and here's our clavicle. Okay, and we have some specific parts of the scapula which are important. This is the acromion process. You guys remember that guy? And then we have the coracoid process, but he's hidden underneath a ligament, so we'll talk about him later, okay? Or her. All right, so those are the easy ones, starting there. But we'll go next then to the muscles, right? We have two muscles that are connected here, that are shown on this figure. The first one is one you're very aware of, right? The tendon of biceps. Right? And it is actually wrapped in a tendon sheath. And what is a tendon sheath?
It's like a hot dog bun.
Yeah. Right? So you've got a bursa, the hot dog bun, wrapping around the tendon. Yeah.
So like all these, how far up is the actual tendon attached? How long is it actually? Is the tendon sheath just that end part?
No, it goes all the way up here.
So it's attaching way up
where the tendon attaches. Yeah.
Okay. And the tendon rides inside of the way up.
Right. All along inside the joint where that tendon is until it attaches. Okay, quiet please. It is wrapped in the sheath to keep it from rubbing against all the other stuff in there.
So it's Bursa, it does wrap all the way around like the top.
Yeah. It's like a corn dog, sure.
Intertubercular glue. Like that's where it runs up through the.
I'm not sure. I'd have to look that up.
But it's called a bursa.
The sheath is a bursa wrapped around a tendon, right? So all it is a bursa, but specifically around a tendon. Okay, we have another muscle here which we're also familiar with. All right, this is the supraspinatus, right? All right, so those are the only muscles we have on here, okay? From there, we can go, let's talk about some other things that we know. We know that there's going to be, because this is a synovial joint, we know there's going to be a synovial membrane, an articular capsule, and hyaline cartilage. Okay, so let's start with the cartilage. This is our articular cartilage, covering both sides of the bone. And there's one other one we should have labeled as well. And that is this depression the glenoid cavity, right? Which we also remember from the scapula, and that creates a depression for the ball of the head, or the head of the humerus, to fit into.
Is that indicating the green thing?
It's just talking about the space there, but yeah. But it would be formed by the bone, and then it is also extended by this piece of fibrocartilage called the glenoid labrum. Okay, so you have the cavity, and then you have this fibrocartilage, which extends from the cavity created by the bone to make it even bigger where the head of the humerus fits in. All right, and then over here we have our articular capsule, which has two layers, our outer fibrous layer. And what is that made out of? What tissue? Just remember? Dense. Irregular connective tissue. Good. So let's do DICT just for fun. And then on the inside we have the synovial membrane. I'm running out of room. All right, so the new players that we have are the glenoid labrum, and our tendon sheath. Everything else should be familiar with you. You should be familiar with, all right? So far. All right, we also have on the other side, around the tendon sheath, bless you, the articular capsule on the other side. And then we just now have a couple ligaments and a bursa that we're going to name. But these are going to be named based on the things that we already know. Okay, so this gray thing here is a bursa. It's called the subacromial bursa. It's under the acromion process. Subacromial. So that's easy, right? This ligament here is covering our coracoid process. It's the acromial ligament. All right, so we got the coracoid process and the acromial process. That's where it's going to and from. And then the last one is connecting our clavicle to our acromion process. So it's the acromioclavicular ligament. Okay, all of that holds your shoulder in place, cushions it, allows it to move, and gives it the largest range of motion than any other joint in your body. Okay, so that doesn't seem too bad though once we break it down, right? Okay. You could just memorize it, or you could think about it. And that should make it easier, right? Yeah. Thinking is hard too, yeah. Okay, the shoulder then. All right, can you put a star next to all the structures that have a synovial membrane? Can you put a triangle next to all of them with dense regular connective tissue.
Articular cartilage?
No, that's just cartilage. The articular capsule, though, yes.
The membrane of the articular capsule.
So just the same thing. Put a star next to all of them that have synovial membrane. Put a triangle next to dense, regular connective tissue.
Materials the labrum made of?
The labrum is actually made of fibrocartilage.
So it's similar to the meniscus.
Yes.
Yeah, that's
The tendon sheath be also dense regular?
All right, what do you guys think? What's the tendon sheath? Bursa, right? So it is a bursa synovial membrane filled with fluid. Okay, but the tendon itself then would be dense regular.
So a star next to tendon sheath?
You would put a star next to the tendon sheath, yes. Mm-hmm. It's made out of hyaline. Articular cartilage is made of hyaline. All right, so because you are so well versed in tissues, bones, muscles, and now membranes, you know a lot about these joints already, right? So now I'm just going to ask you stuff like that on the test to pull some of that information out, right? Yes, digging deep, looking for application. The shoulder joint, we're going to do the same, the knee joint, we're going to do the same thing. Let's start with what we know, and then we'll talk about the things we don't know, and those things are named based on the things we do know, right? All right, so what are our three bones first at the knee joint? Femur. Okay, patella. And tibia. All right, we don't have the fibula in this section, but it's also there as well. All right, so let's continue then on the things that we do know. So surrounding the synovial joint is going to be what? Articular capsule, right? And we won't break it down into the two parts, but that's because we don't have room there. But those are there as well. And then these kind of get jumbled up here. But this one is pointing to the synovial cavity where the synovial fluid is abundant. All right, we have one muscle, the tendon of the quadriceps. There are other muscles which are important, but this is the only one we're going to highlight here in this cross section or in this this view.
The quadriceps?
DRI. And we've got the meniscus. We can only see one here. This is the lateral meniscus. Okay, and it has it labeled on both sides, I think, here. All right, so to put that in context, we're going to go look at...
How is that?
It's just how it was cut, so it's going to be the lateral side, right? But there are two, right? And if this is the anterior end of our tibia, the lateral meniscus is going to be on the right and the medial meniscus on the left.
Oh, I see.
So it's just cut on that side. All right, now the meniscus are covering another layer of cartilage, which we've seen lots of times, our articular cartilage. Okay, so we have an articular cartilage of the lateral meniscus, and we have articular cartilage of the medial meniscus on both sides. All right, going up in between those, off of the tibia and then connecting to the femur, we have two ligaments, okay? And you can't see them very well here, but we're going to label them anyway. So this is the anterior cruciate ligament, and this is the one that tears most often in sports injuries. And then the posterior cruciate ligament. All right, and again, you can't really see them very well in that view, but over here, you can see where they're placed better.
Why does the ACL tear more than the PCL?
I think because it's where most of the range of motion is, right? The one in the back is
Oh, because you don't.
it's on the hinge, right?
I see.
Yeah, it's like you get terrified of twisting stuff, but the PCL, you can actually get a straight hit into the front and push it all the way back.
Yeah. It's exposed more than the posterior one. All right, so we've got a couple more things on here. Now we're getting into the bursae, and we've got one more tendon. This one on the bottom is the easy one. So the one going from the patella down to the tibia is the patellar ligament. All right, and then we've got some yellow stuff in here. And this is inferior to the patella, so we're going to call this the infrapatellar fatty pad. Or fat pad. I like fatty better though. All right. And so now we have, let's see, I think we only have the bursae left. Okay? And they're just named after their location next to the patella. So if it's superior to the patella, it's the suprapatellar bursa. Okay, if it's superficial to the patella, it's called the pre-patellar bursa. And what do you think the one below it is called? Infrapatellar bursa. All right, so because you guys are so well versed in the muscles, bones, and directional terms, these are easy.
You're right.
And I have full confidence in your ability to label such things on an exam. Yes?
The word that starts with a C, is that an R right after it?
Cruciate? Yeah. You just these two joints, yeah. Knee or shoulder. If you look on the practice exam, the shoulder is on there. Okay? But I listed not only labeling it, but also I said like put a star next to structures that have a synovial membrane. Okay, so which would those be on this figure? Okay, so why don't you and your neighbor discuss, and then we'll come back and talk. So you would put a star here, and a star here, and a star here. Would you put a star anywhere else? Sorry.
Where the articular cartilage is between the
It's not labeled there, so we wouldn't put it over there. But the articular capsule is made of what?
2 layers.
2 layers, the fibrous layer and the synovial membrane. Okay, so there's 5 things there. All right, another thing on the practice exam that I put is I'd like put a triangle next to dense regular connective tissue. Okay, so what would be made of dense regular connective tissue in this figure? The fibrous layer is not, because it is dense irregular. Ligaments and tendons are regular, dense regular connective tissue. So you put a triangle next to the patellar ligament, the tendon of the quadriceps, and the anterior cruciate ligament and the posterior cruciate ligament. Yes, tendons and ligaments are dense regular.
What is a meniscus?
Meniscus is made of fibrocartilage.
Okay.
Okay, and then articular cartilage is made of hyaline. And then you have bone, and then you have skeletal muscle. So those are, and then you have fat in there as well. So you have adipose tissue as well. So those are probably all the different types of tissue in there. All right, if we went to back to a good list of joint movements, you guys know these, right? Okay, so everyone abduct your arm. Just move it away, right? Okay, and then adduct, you put it back. All right, do a flexion of your elbow. Okay, extension. Now, hyperextension. Probably don't want to do that one. Okay. Okay, rotation. Where can you rotate? Have rotation in your arm, yeah. Your forearm rotates as well, and your leg you can rotate out, and your neck. Okay. All right. Circumduction is a complicated, right, multi-plane arm movement. Yes. Yeah. You don't want to hit somebody. All right, elevation and depression. You can do that with your jaw. You can also do it with your shoulders. Protraction, retraction. You can do that with your neck. You can do it with your jaw. You can do it with your shoulders, I guess, a little bit. Moving forward. The shimmy. All right, inversion and eversions with your foot. Eversion is turning out, inversion's turning in. Pronation and supination. So this one's the hand, right? Supination is palms up. Okay, and it has the U in there, so that's how I remember it. Palms up.
But isn't that also when you go on like prone and supine? You're up and supine, and your hands are down and prone.
Yep. Yeah, pronation down, supination up. All right, dorsiflexion, toe up, plantar flexion, toe down, opposition, finger. All right, you got all those? All right, so here's a great, this video is kind of long. Maybe we won't watch it. But you can watch it if you want. It's a pretty good explanation of all these. He goes through different parts of the body and then the different movements that they can have in the different parts of the body. But yeah, it's like 8 minutes long, so you can watch that. All right, so what I want you to do now with your neighbor, what joint movements can you identify on these different pictures? Okay, so go ahead. You can write them. You can write on there and point out. There should be quite a few in each of these pictures. Then we'll go over. Yeah, you'll have one of these on the exam. Yeah, so your thumb opposing.
What about like finger?
Oh, we just talked about it.
We didn't know. We just wanted.
It's not really opposing as much, at least not as much, right? Because you can get your finger ends are completely opposite.
So it's like
This
hand
is
to
like-
hand, like opposition, like something like that? Or does it have to be like in the same area?
Yeah, I think it's only referred to your thumb,
Okay.
opposing your fingers. Yeah.
It's not there yet, but it's gonna be. He's actually laying down on the ground.